Hi, this is Sharita. I just need a few more minutes. We're having some technical difficulties at the moment getting Dr. Banks on here. So I'm going to mute myself, but please stay by for updates. Thank you. Hello. Just waiting for Dr. Banks here. Thank you all so much for joining us. We really appreciate it. Hi, Dr. Banks. Thank you so much for joining us today. Can you hear me all right? Let's see if we can. You're on the stream.
Okay.
Beautiful. Thank you so much.
Good to see you.
Good to see you too. All right. So a brief introduction. And actually, I was going to do something a little bit more formal, but I think to introduce you, but maybe you can introduce yourself. I feel like it's the best way to our audience to get to know you. So Dr. Banks, why don't you start, introduce yourself, and then I can go and we can start the questions from there.
Okay. So my name is Dr. Judy Banks, and I'm a board-certified obstetrician gynecologist, and I'm really happy to be with you this afternoon to take your questions. I've been an obstetrician gynecologist for many, many years, and I love what I do. I consider it to be a privilege to have taken care of so many women having their babies, and in this time, which I know is stressful to many people, I want to be able to to give women some information and to have a spirit of some optimism and hope that they are going to be able to have a very positive birth experience, and to reinforce that an occurrence in life, which is one to bring people much happiness and joy, that still can occur even in the midst of these challenging times.
Perfect. Thank you so much. Yeah, and I think just to piggyback off of that, thank you again for answering these questions that our audience has. All of these, the answers I would say, might be personal to you, right, to your care provider. And so Dr. Banks will be talking in general terms. We realize our audience is, national capacity here. So every state, every hospital, every county is doing something different. Every city is doing something different. So you want to work closely with your care provider in determining what is best for your prenatal care. So I just wanted to be very clear about that as we move forward. And, if there are any questions that come up through the chat, we will try to answer them if we have time. So I will start. And I think the first question is, can you explain to us exactly what COVID-19 is?
So COVID-19 is a airborne viral infection. Coronaviruses have been identified and are very common viruses, but this is a new virus, and it has not been seen before. And as a result of that, what has happened is this has created a very significant illness in the population because they are in no way immune to it. As I said, it is airborne. It is a droplet infection, which is why there is so much emphasis on social distancing, so much emphasis on people wearing masks.
Perfect. Thank you so much. As a pregnant person, am I at higher risk of getting COVID-19?
No, pregnant moms are not at higher risk for getting a COVID-19 because, as we said, it is spread through a droplet infection. People need to be in proximity to where the virus may be present in the environment, and their risk is the same in the pregnant as in the non-pregnant state.
Okay, perfect. Thank you. As a pregnant person, what should I do if I am showing symptoms of the virus?
Well, if one is showing symptoms of the virus or they suspect that they have it, they should immediately get in touch with their contact with their healthcare provider, who can go through the list of symptoms, that they have. Okay, they can, tell their provider, if they're experiencing, fever, if they have cough, if they have, nausea, vomiting, any symptoms that they have in this time that they are not experienced previously. It would be well for them to contact their provider and to discuss with them what is going on.
Okay, thank you. How can I reduce the risk of contacting COVID-19?
Well, again, the same recommendations that are, offered to the general population would certainly be, appropriate to pregnancy. People want to stay in their home except for necessary interaction with other people. They want to make sure that they do have social distancing, that they maintain the 6 foot or greater that has been recommended if they are out in public situations. They want to make sure that they, wear a mask. And the purpose of the masking, which I'm sure that most of the audience is aware of, is that what has happened with this virus is that there are people who can have the virus, really not be aware of it, really not have any symptoms, but they can shed the virus. So not only do we want to protect ourselves, we also want to be in the position where we are protecting other people. So we also do not want to be asymptomatic shedders and putting other people possibly at risk from catching an illness from us that we maybe never knew that we had the possibility of transmitting. So those are the things that are recommended from that standpoint. Obviously, if one has been out, one wants to be, very careful about hand washing. Okay, I think we've all seen the ads now, which say that you should, wash your hands. That you should have like at least the 20 seconds. Should be using lots of soap and water. Make sure that one's hands are very clean. Hard surfaces, what we know is that the virus can persist on hard surfaces for a number of days. We know that it's very sensitive to water and to regular, household, cleaning products. So we want to make sure that we've cleaned, areas that, people, touch. So counter surfaces, doorknobs, that tell people their keys, their cell phone. So we want to keep, everything as clean as we can. And we want to make sure that we wash our hands frequently, because we want to be very careful about touching our face. We know that this virus is droplet, as I said, is, spread by in contact with viral particles off the surfaces, can also be enter the body through the eye. And so even though, you have your mask on, you want to be sure that you're not rubbing your eyes and things. So you just want to be as vigilant and as careful as one can.
So covering your mouth, like when you cough, when you sneeze, is highly recommended.
Absolutely, yeah. And those are the things, I think those are some of the things that we learned in kindergarten, right? We always want to cover our mouth.
Well, you just never know. Sometimes we forget. So I feel like a friendly reminder is always good.
That is true. Yeah.
Yes. Okay. Well, I think also to the point of, the precautions that you can take, the risk. If you are still doing prenatal care, and actually, let me step back. Is prenatal care still an option? In-person care? Are providers still doing that?
Yes, prenatal care is very important. Obviously, different things are happening across different states and different communities. People need to reach out, moms, to their providers to see what has been put in place for them. I think that we have to remember that anything that can happen during the time of this COVID pandemic. Also, there were conditions in pregnancy that and growth in pregnancy, and just communicating with your provider, that took place before this ever occurred. So, what some providers have decided that what landmark weeks of pregnancy that it is necessary to physically perhaps see their patients in person. There may be people who have other medical problems along with being pregnant, that their provider has decided, this is something that I physically need to see you. And there have been instances where telemedicine has become more prevalent. Here in the area where we are, here in the Northeast corridor, telemedicine is not as popular as it is in many, areas of the country. But there are many areas where, people are further, removed from their providers, or there are areas where people just, in the course of normal prenatal care for the lower risk patient, that this has turned out to be a very viable option. And these modalities have already been in place, that people are doing telecommunication with their provider during pregnancy, and that they have reduced some of the number of in-office visits. So these are very viable options. And again, your particular provider and hospital system, they will direct you as to how they are going to conduct these visits.
Okay, perfect. And also, I think with that, there's fear, right? Fear of exposure. And so a question of, should I keep my appointments, has come up. So I'm going to ask you, should I keep my appointments? And then maybe you can speak to someone who, if they are having concerns, maybe there are questions that they can ask the provider, or things that they can do that would decrease that fear.
So what you should do is you should get in touch with your provider and, see, and I think a lot of providers, they want to maintain communication, with their patients. They're very concerned about, their patients in this time. They want their moms to be healthy. They want their moms to have, positive birth experiences. So they are reaching out to their patients. Okay, this is communication going in both directions. And so you're going to reach out to the offices, and they're going to direct you how they are conducting their visits. Just in talking in my community with some doctors, and what kind of things they had put in place, many of them saying that they are not having patients, wait in waiting rooms. Maybe they're having their patients, wait in the car. Maybe they're calling the patient on the phone and then say, we've prepared the room, okay for you now. It's okay for you to proceed in. There are lots of different things that people are doing, but communication is the key. A well-charged cell phone these days is among the pregnant moms most prized things to have with her. Okay, because people are using them in some ways that they traditionally have not used them to communicate, both patient with provider and provider with patient. So those are some of the things that I've heard, is that people, if they have put patients in, they are limiting the number of patients that they are seeing on that day. They have made sure that they are prepared for the patient, that they have whatever protective PPE that they need. Usually, probably for a doctor's office, they would have their masks on. Okay. They're going to direct you, if you have masks in your possession, okay, that you may want to wear your mask to the office, or certainly that you should have your face covering, okay, if not that you have a mask. I think a lot of the offices are asking people, well, look, do you have COVID symptoms? Okay, have you been in contact with somebody that has COVID? So there's a lot of information that is being, transmitted both ways, so that we know that people are able to proceed to the office and to the actual visit.
Excellent. So keep your appointments, talk with your provider about what precautions they're taking when you go into the office. I think that sounds perfect. And thank you for suggesting that. I mean, so maybe some offices aren't doing those things, and their patient might feel more comfortable implementing some of the things that you mentioned. So I appreciate those things that you've heard other offices doing. Thank you. If I am able to go to a prenatal appointment, will my husband be able to join me?
Well, again, that's something that you have to address to the to the individual office. As I said, these days, because we have so many ways to communicate, it's possible, through our technology, that even if the office says, well, he cannot physically be, in the exam room, that we can remote him in, through, our computer systems, or your tablet, through your phone. So there are ways that communication can be taking place simultaneously.
Perfect. Thank you. And one thing I spoke to earlier was about fear. I wonder if you have any recommendations on how to manage stress, fear, anxiety that comes along with everything that's going on, particularly with women who are pregnant or who have recently given birth.
Well, those feelings do occur, and it's normal, I think, for people to have apprehension, okay, to have anxieties, and to have fear. The one thing that we don't want to be is that we don't want to be immobilized, okay, by fear, and we don't want the fear to totally overcome the positive aspects of the experience that we're going to go through. So I think the main thing is for people to articulate, what their concerns are. I remember a patient telling me something that I thought was very insightful one time. So she told me she had, issues with anxiety, and it was really interesting because she said, well, doctor, she said, what people with anxiety are anxious about, they're anxious about, the unknown. They're not anxious about what they know. And so that really points out the issue that if you have questions, that you should, ask those questions. That if you have, fears and concerns, it's not a weakness to share those with people within your family, within your circle, and with your provider, because a lot of times if you get the answers, to some of the questions that you have, you are going to feel less fearful and less apprehensive.
Excellent. Thank you. So I think we should move on to delivery. Again, I just want to stress that these are general, right answers. Talk with your provider or the hospital. I know hospitals are extremely busy right now, so you may not have success in talking with the hospital directly, but I still encourage people to try. And if not, your provider will be in communication either with your hospital or birth center, wherever you're choosing to birth. Be sure that you know what policies are currently in place. I am going to ask Dr. Banks about screenings next. I think she can talk about the hospital where she works and other things that she has heard other hospitals doing. So in entering the hospital, what screenings are they doing? Are you aware of any?
Well, again, things vary by state, things vary by region. Okay, but I think if you look, what is most important to most institutions is they want to hear from you in advance. Okay, if you think that you're in labor or that you have an emergency, they're like, "Can you call ahead?" Okay, and most patients that are pregnant, this information has been given to them, by their provider. Just even in terms of just general OBGYN, emergencies, to who to call, when to call. And so they want to hear from you, ahead. A lot of times it can be helpful to some of the information that you were going to get from the patient, maybe when they, came, directly to the unit in this time. It's very important, okay, to institutions to be able to know what patients or they that say, listen, I know that I am COVID positive. You may have a patients who say, well, what, I had a test a couple of days ago. I'm waiting for my results. I don't know if I'm positive. Okay. Or you have, patients that say, I haven't been out the house in 6 weeks. Okay. And I haven't been in contact, with anyone. So people need to talk to you. They need to be able to direct you to the appropriate place that they have set up within their institution for you to have the access that you need to come, to the labor and delivery unit. So that can only be determined, by the institution that you're going to go to and by the providers. So again, those are, some of the things that they're going to tell you. So you want to give yourself enough time, though, when just with routine things, so that you can call ahead and say, look, what, I think I might be in labor. Is there anything that I should know, anything different, that I should be doing? And these are things also to discuss at your prenatal visit, particularly if you're in the last weeks of your pregnancy. It's like, well, doctor, when it's time to come to the hospital, what should I be doing? How far in advance should I be calling you, or should I be calling, the hospital? Or if I have an acute emergency, again, how should I be handling that? Should I be letting the hospital know? Should I be letting you know? But again, communication is the key here, so that people know where to go, under what set of circumstances, not only in relationship to what is going on with them obstetrically, but also how this should be handled in terms of what the COVID-19 guidelines are.
Excellent. Thank you. Are all pain management options still available during this time?
Yes. Okay. I have not in my readings or in conversations with colleagues seen that there is any difference in terms of pain. Well, I shouldn't say that. Okay, there would be two things. Okay, there would be considerations in hospitals that have nitrous oxide. Okay, for for pain relief, those are aerosol agents, and those without question, I would assume, okay, across the board, are contraindicated because they're aerosolized. So that nitrous oxide would not be an option for for labor. Okay. In terms of anything that is given to patients, like continuous epidural anesthesia. Um, uh, there are some interesting things about people who are COVID positive. Okay, and some of the blood work and some of the labs, which possibly, in theory, would maybe make people change what the anesthetic option could be. But as a general statement across the board, I think that with the exception of anything that could be aerosolized, that our standard epidurals, those are going to be available to our patients. I mean, obviously, any places that use any intravenous medications or anything like that, those options, there's no contraindication.
Okay, perfect. Thank you. Um, I heard that laboring mothers need to wear masks while at the hospital. Is this true? And while they are maybe even breathing, pushing down baby, can you speak to that? Have you heard that?
Well, we got to go back to what we know about, COVID-19, and as I said, what it is. It is an airborne droplet infection. So the general directive, really across the country that we've seen, and I see even more and more, like just like in watching TV now and seeing the different stations, we see that the reporters and different people, have their mask on. They're showing people who are out on the street for whatever reason they may be out, that you see people putting, masks on. Remember that we said that cloth coverings are really to prevent, from what is in, our mouth and those being, aerosolized and pushed out into the environment. That the personal protective equipment, I cannot speak for what is happening across, all hospitals and the thing, but it is reasonable that in many institutions what has happened is that the patients are given face masks on labor and delivery, because at the time that we're pushing, that's a lot of physical activity, okay, and that's a lot of exertion, and there is you have to to bear it down, and so to aerosolize our environment, it's just it's natural for that to occur. So patients have been asked to wear masks. Their support persons even masked in many situations, I understand. And so these are reasonable things to do. Just as you feel confident and they are protected, yeah, they want to do what they can do to keeping the hospital a healthy environment for both themselves, for their baby, and for the next person that's going to have to come into that unit. So it's a matter that we all work together to decrease the chances of other people becoming infected.
Thank you. I have actually just, I'm curious about something that popped into my mind. But I know when I was laboring with my daughter, I was able to walk around. I was able to leave my room, explore the hospital campus. Do we know if those things are still being allowed, given like visitor restrictions and things like that?
Well, again, as I said, we always go back to the same point that you must check with your, institution. But I don't think that it would be unheard of, okay, for them to say, no, we must restrict, okay, the circle of people's movement so that we can be sure, okay, that we are containing in as much as we can the spread of this virus.
Okay, thank you. Are you aware of extra precautions that are being taken to safeguard pregnant and delivering women when there are current patients that have the virus in the hospital?
Well, we come from a very diverse, country. The capability of some institutions is not the capability of other institutions. The level of acuity of certain, hospital situations are not the same as others. Okay, that, being said, I think that most institutions, the goal is to keep the people who are known to be positive, to keep the possibility of spread contained. So that's the reason why that they want to talk to people when they come to hospital, why they have restricted visitors, because they want to can help identify in advance someone who is without question positive, someone who maybe there was a probability, and someone who does not, so that in as much as they can people individualized into different categories so that they can keep them safe. And so, I think that is a fairly common public health premise, that you want to keep people that have an infectious disease, separate people who do have. And when people think about when they visit hospitals and stuff, like precautions and isolation precautions are very common things that are present in hospitals. And we see this on all hospital floors. Somebody may have been admitted, they have pneumonia. You went to visit them, and you could see that it says that there's a respiratory isolation. Maybe it says on the door of that patient's room, you should have a mask on, you should have a gown. These are just very common, public health, policies that are meant to protect both the patient and to protect, the other people who are present in the hospital environment. So hospitals are doing everything that they can. They may be doing it in varying ways based on their locale, but they are trying to keep patients safe also.
I appreciate you speaking to the point that, patient isolation is a common thing. Hospitals already have protocols in place, especially for someone who may not, right, a pregnant person may not be at the hospital as often as someone else. So there might be their first time there. This is all new and overwhelming. But I think, knowing that these things are already in place, right, it can happen at any point, whether it was COVID-19 or, like you said, pneumonia or whatever, any respiratory, any type of isolation that might be going on, you might see those signs anyway, right? Regardless of what's currently going on. So I think that's actually a great point to make. Thank you for that. Will there be forced separation of mom and baby in the event of a positive COVID-19 test? And actually, I'm curious, are all pregnant women being tested for COVID-19, or is it because they might show symptoms?
So what has happened, nationwide, of course, we see this great emphasis on the availability of testing, and, protocols are evolving as to who will be tested, when they will be tested. In the ideal world, to have a rapid test to, test, moms on, delivery, to, on arrival to labor and delivery, and who the person, to know at the point of service whether or not the person is positive, would just be awesome, because then you would know how to handle every single solitary patient is not where we're at right now. So in the case where there is a known COVID positive mom, again, these are conversations that the patient and her family have to have with the provider. That we universally know that there is not a vertical transmission. In other words, when the baby's inside, we know that there is no transmission of the COVID-19 virus to the baby. And this really is, really is a blessing, okay, that it is not transmitted in that way. Once the baby is born, okay, the virus, though, can be, the baby can catch, okay, the virus from an infected individual. So as I said, cannot speak for other institutions. And actually, today I'm not here speaking on behalf of my actual institution. But I think it's a public health policy, if we read some of the recommendations that we see, that it is advised that the baby be from, because doesn't want her baby to to get this respiratory infection. In the case that and usually my understanding is that they test the baby to see if the baby is negative or positive. Okay, the breastfeed. If moms are choosing to continue to breastfeed, they obviously have to have on the appropriate mask, appropriate washing, and things to reduce any type of transmission need to occur. I think in a lot of places they are asking moms to express, breast milk, and then this would be given, to the baby by someone who is known to be, COVID negative. And I cannot actually, speak as to, the length of time that they are recommending, separation if the mother and or if the mother and the baby are both positive, or if the mother is positive and the baby is negative. Again, that is something. These are discussions that had to be had at the individual institutions, both with the obstetrician, but more importantly with the pediatrician, because really it's the pediatric departments who are going to set what the policy and what the recommendation, I should say, really the recommendations, and from that the policy, which is needed to try to keep this precious newborn as safe as they can. Okay, which is really what the goal is for both the parents and the providers. We're all on the same page. We're all working towards the same end result, that to keep these babies and to keep these babies safe.
Okay, perfect. Thank you. Um, and I believe this is going to be based on hospital policy, but do you know, are partners allowed, let's say in the hospital room, but maybe you have a planned C-section or cesarean section, or maybe even emergency? Do you know if partners are currently being allowed into the OR?
Again, I believe that probably varies by state, by location, and by hospital policy. And people need to to ask that in advance. As I said, I think that one of the biggest things is that information and being prepared really does help to decrease the anxiety and helps with the decisions. And that the questions that I hear that you're asking me are very definitely things that people want to discuss with their provider. I think that what happens is that the angst and the pain really occurs when people thought it was going to be one way, and then they get there and they find it was something different. So I think if people know in advance and they ask their provider, look, if am I having maybe a repeat cesarean section, we know this is planned, okay. I'm not a candidate for trial labor. I know definitely I have scheduled cesarean section. So what's going to happen is is my support person going to be there with me? What are the current policies? What are you basing those on? So that everybody's prepared and they know what's going to happen on that day, in as much as they can.
Excellent. Thank you. Um, you answered the question, can I transmit the virus to my baby? So you cannot. After delivery, it might be possible, just because it is, it could be in the air if someone is positive, correct? But otherwise, you should not be concerned in utero about transmitting the virus to your baby.
That is correct. Okay, that in utero, but once the baby is born, it is possible if the mom is, positive, that it could be transmitted, correct?
Okay, perfect. I've seen this quite a bit. This question came up. Should I change my labor and delivery plans? Should I think about doing a home birth? I've seen a lot of discussion out here in Arizona where I'm at about, switching to home births. So I wanna hear what you have to say to this.
Well, I think that one thing that you said is very key. You said switching, okay, to home birth. And my, opinion of that is no, people, should not, do that. Okay, you have to remember, okay, that that having a baby in a hospital, there are many positive things that have sprung, from that. Acute emergencies can be handled acutely, and hospitals have decreased, okay, the chances of people losing a baby in the labor process. I mean, it is a known fact, okay, that any kind of acute emergency is better handled at a facility where, the equipment, the personnel, where there are things available to do that. So I don't think that people should, change, and they should switch from having their, birth in a hospital, to now doing that, at home. I think they're much safer, actually, within the institution. I know people say, well, I don't want to catch, the COVID, in the hospital. But the reality, is that there are other issues involved. That it's not just simply a COVID, issue. There's other surgical issues, and the hospitals are, doing everything that they can to keep you okay from, picking up an infection within a hospital. That's why they're asking everybody, let's work together, okay? You see our obstetrical team that, we're doing everything that we can to identify, what the status of people are. We are using our personal protective equipment, our, ancillary, team members, our maintenance crews, our housekeeping people, our food service people. Everybody is doing everything that they can to keep you safe, with this and within this environment. So I think that people should, feel comfortable. I also think that, people, if they chose, to have a home birth, okay, they weren't planning on a home birth, but they're switching to this because of the virus. If they have any type of emergency or they had a reason to come to the hospital, it makes it much more difficult, okay, and much more time consuming to do something in the midst of, a process. And I think that they actually put themselves obstetrically at greater risk. I think that it's better to know, how the process is going to go, where you're going to go, how you're going to get there, not to be in the middle of acute emergency and then have to proceed and have to have these issues worked out.
Okay, thank you for that. And I think though, if you, let's just say you were thinking about switching, you should reach out to your current provider, have conversations, explain to them why, right? Again, this fear is sometimes the anxiety, the fear, there are questions that maybe you don't know the answer to that your provider can answer, that may cause you to say, actually, the hospital is still currently my best option. So I encourage you, again, to have these conversations with your current care provider, especially if you're thinking about a home birth, and is it right under your medical circumstances. So I just wanted to put that out there. And then our care providers, are they still doing in-person postpartum checkups? And I think that's typically maybe 6 weeks postpartum. Is that right?
Well, again, it depends on the circumstances. Okay. I think that a lot of, women are aware that across the country, that hospitals and providers are trying to increase safety, okay, of pregnant women and women in the postpartum period. We had traditionally, felt like, oh, once the baby's out, everything is good, it's in 6 weeks. But, what time has shown that there are some issues that can occur postpartum closer to the time of the delivery than 6 weeks. So doctors are staying more in contact with, women after they give birth. We're interested in, how moms are coping in this time of stress. We're even more interested in depression screening, in, social and other issues that might be going on within the patient's environment that possibly providers and some of the services at the hospital can be helpful to moms with. So we're staying more in contact with people during this time as opposed to less. The contact is a lot of it is through telecommunication. There are like so many things that we can do remotely if we're interested in checking people's blood pressure. People can have their own home blood pressure cuff. They can let you know whether or not there's any issues of hypertension. And talking with people if you want to know are there any issues regarding stress or coping with depression, you can get that information, that feedback from the patient. In terms of the actual postpartum visit, and physical examination, that would really depend on what the provider knows about what occurred at the time of your delivery. Is there something that they need to physically see, or are these questions that could be handled remotely? I think that hopefully we'll be able to get back to the time when moms will have their postpartum visit. I remember as a provider, it's always really nice to see the baby because they always bring the baby back. So everybody the baby. So that people can get out and people can have this interaction, but we don't know when that time will be. But certainly, all the medical issues, without question, can be addressed. And if there's a circumstance where the provider knows, I need to see this mom, then they're going to tell you what they need to do, how they're going to set up the visit, where you're going to go, what recommendations or precautions they're saying that we need to do for this visit. But I feel pretty confident that providers are going to be, if you need to be seen, we're going to see you and see what the issue is. And if there's things that we physically do not need to have contact for, that we can resolve those through some form of telemedicine. I think it's important for moms, that, during the last week of their pregnancy to discuss, when are you going to want to see me next? How are we going to, arrange that? If they have questions that they know in advance regarding maybe breastfeeding, contraception, issues that they would have discussed, postpartum, that part of that dialogue be initiated in the, the antepartum, time also, so that a lot of questions that people might have, they can start getting answers and information about.
Excellent. Thank you. I appreciate that. We actually pretty much are at time. I don't think any questions have come in. Do you have any parting suggestions, words, recommendations to our audience?
Well, I guess the main thing that I would say is for women to to stay encouraged. That this is a difficult time in our history, and it's a difficult time to give birth. But nothing, I don't think, reaffirms life more than birth does. Okay, and nothing makes us more hopeful than does birth. So I think that, people should, as I said, they should stay encouraged. They want to be wise. They want to be prudent. Okay. They want to get the information that they need, but they should be hopeful, and they should, you know, um, this is going to be a joyous occasion. Having your baby, even though in the midst of all these trials, is really going to be a joyous, occasion. And I listened to a webinar where I'm stealing this from a colleague who said this, about the mask. And what she said was that, like, yeah, you have to put your mask on, but think of your mask as a megaphone. Make your mask the reason that that you have to use your voice, that you have to speak up, that you have questions, ask those questions. But, in the end, for people to go back to what they know, there have been very many difficult, moments in history, but we have, persevered, and we have moved through, and, many good positive things have come after.
Excellent. Great words to live by. Use your voice, ask questions, communicate, communicate, communicate with your care provider, with your partner, with your support people. Thank you so much, Dr. Banks, for joining us today. We really appreciate you. So knowledgeable. Thank you for taking the time. I know you're extremely busy. This has been incredibly helpful. So thank you so much.
Okay. Thank you, Sharita. Thank you, audience also.
Stay safe.
You too.
Thank you. Bye.
Bye.